I worked at a very prestigious local university hospital system in the Pediatric Transgender Center. And in 2023, I became one of the first public whistleblowers in the United States to shed light on some of the horrifying abuses and mistreatment that was occurring. This entire field is based on this idea that if you intervene quickly and early in young children, and that intervening would be to give a puberty blocker and then cross-sex hormones to children to permanently physically change their secondary sex characteristics to present more as the opposite sex. When I first started, I thought that we were basing all of these clinical decisions on well thought out standards of care that had been rigorously tested over and over again. What I started to see in my tenure, first of all, is that there was no consensus in this field. So even the doctors who were prescribing were all over the place. Some thought we were treating this mental health condition called gender dysphoria. Some could have cared less if you had that condition. If you claimed that you were trans, and that was good enough for them. And what I also saw was that these written protocols, they were written by this, what I came to find out was really an activist organization called WPATH. These guidelines were not like guidelines you see in other kinds of care. So the guidelines would say, don't give this to kids under the age of 16. But if the clinician really feels like you should and there's special circumstances which nobody defined, go ahead and give it younger. We had started it at 16. Within 2 years, we're giving permanent medical interventions to 13-year-old children. And I'm going, this is not how guidelines work. This is not how medicine works. And this was purely ideological. I was just aghast at how truly kind of not scientific any of this was.